Hey everybody, so today I'm here to talk about one of the big questions that comes up with patient payments, and that is, should I be the bank? In other words, should I sell my contracts out to lenders, or should I personally take on the financial responsibility of allowing a patient to pay over time? Now, this is a really important question because when you're giving services that require third-party products, for example, lipo laser, right, which has a cost associated with the purchase of the equipment, and so each time a patient goes to use it, there's a cost to you. And by giving it by allowing a patient to pay over time, there's a certain amount of cost that you absorb personally, unless you give it to a lender, in which case they absorb it. Now, of course, your margin is lower when you go to a lender, right? So you're going to make a little bit less money. The interesting thing here is, anyway, to me, isn't so much the difference in the margin, because really when you talk about the difference in margin, you can achieve collections success in really either case, right? You're gonna have good collections in either case. Obviously, you might get better collections, by having the margin yourself, as long as initially you don't mind taking the brunt of that financial responsibility. So you'll see more variation at first, and then a bigger payoff later on, because generally the profit is made towards the end of a payment plan, not in the first 6 or 8 months. So when we talk about visits, that's really where the interesting thing is, because really the interesting thing is the patient. The interesting thing is, am I getting somebody better, and am I doing it in a way that makes them feel loved and cared about and a part of a community? And so what we tend to see is when the practice sells their contract out to a lender, that lender doesn't necessarily have the practice's best interests in mind. They have their financial profits in mind, their revenue in mind. And so what you'll end up seeing is more complaints from the patient about how the lender might be treating them. Some of that can be mitigated depending on the lender that you choose, making sure that they have good practices and that they follow up correctly. The other issue that comes up with using a lender is that there's an interruption in branding. There's an interruption in the actual engagement with the patient in the practice. And so, some people will say that that's a good thing, because the less that you are directly talking to a patient about cash, the less they feel the pinch of each penny, and so the more they're going to be engaged with you at the clinical level, which is the most important level anyway. But other people will say that that interruption will cause them to see your practice at the corporate level and not on the human level as a small business. So you might run into an issue there. So sometimes that can have an effect based on the community. If you're in a more rural area, if you're in more of a farming community or more of a suburban area, you may benefit from actually taking that on yourself, because there is some level of tension. More of an urban setting, you might find that people are a little bit better about that, a little bit more easy about that. But generally what you'll see is when you take the responsibility on yourself, and in a small way, you humbly bring up the fact that that's what you're doing, your patients will inevitably respect you more. They're going to look at you as someone who is going out of their way to make sure that that patient is well cared for, is well taken care of. This is really important when you're looking at whether or not you should be the quote-unquote bank for your patients. There's an advantage to using lenders. It certainly improves efficiency. It takes the brunt of the work off of the office staff. Whereas being the bank yourself may end up making the patient relationship better, and in the end, of course, your margin will be higher. But there is an increased workload, of course, because you need to actually follow up with the patient, especially when they miss payments. And that'll have something to do more with credit scores, things like that. And so the recommendation here really is, if it's something you're looking to do, in either situation, however you're leaning, speak with somebody, speak with a payment processing company like Fortis or ClearGage or Cash Practice. These people deal with these things day in and day out. And so when you speak with them, they'll be able to give you recommendations based on your situation, based on your concerns, and of course speak to your coach. Speak with me. We can go over your specific situation and see what the best recommendation could be. But again, generally, the more you can have direct contact with your patient, the better.